You know, for most of us, getting a cut or a scrape is no big deal. The wound should heal itself. But nearly 5 million Americans have problems with that healing process. East Cooper knows health, and today Dr. Tim Osborne is here with East Cooper's Advances in Wound Care. Doctor, thank you so much for coming on the program. We appreciate it.
It's good to be here.
Well, tell us about what wound care is and how that differentiates from the normal cut and scrape that we get.
Well, typically when we're younger, cuts and scrapes heal themselves. Your body takes care of those issues. What a wound care clinic is, especially when it's an advanced wound care center, it kind of puts to work all the modalities that we have in medicine to heal wounds, especially in problem patients. This is usually not a problem for pediatric patients in the younger set. However, as we begin to age and disease catches up with us, diabetes, venous insufficiency, arterial insufficiency, things that tend to affect our extremities particularly, those patients oftentimes will develop wounds that simply won't heal. They can be very frustrating for the patient themselves and for the physicians who are treating it. Typically, they'll start the treatment in a family practice setting or internal medicine setting, and they'll find that it just does not heal. The reason it's not healing is because there are factors that they just are not accounting for. And a wound care center allows us to kind of put everything into play at once. That includes a vast array of topical dressings and things like that, but also hyperbaric therapy, whereby we put a patient into a chamber, inject 100% oxygen, and increase the atmospheric pressure. What that does is allow the wound, which is oftentimes hypoxic in the center or lacks oxygen in the center of the wound, to get the oxygen that it needs, and then also to stimulate the healing process that want to occur, but are just frustrated by the endemic disease that already exists in these patients. And it tends to be the older ones, diabetics and venous insufficiency patients.
So it's taking that idea of let it breathe a little bit to the next level.
In a manner of speaking, yes. It's kind of from the inside out.
Yeah.
And what we do is they're literally breathing in 100% oxygen. We're breathing 21% oxygen now at 1 atmosphere of pressure. We're increasing that pressure upwards of 2.4 atmospheres of pressure. So they're breathing oxygen at the equivalent of about 47 feet underneath the surface of the ocean, as if they were scuba diving. What that does is that's a pushing pressure so that the oxygen gets into the wound bed, allows the collagen and all those sorts of things that have to happen for a wound to heal to take place, and they would not otherwise. And so advanced wound care, and it's not just at East Cooper, but around the Lowcountry now, they're good options for patients to use and to utilize, and the family practice and the internal medicine docs are seeing that and finally putting them to work.
Fascinating stuff. Now, say a person at home that has a wound that is nagging or that's just not healing, what do they need to do, and how long should they wait before they consider advanced wound care?
These days, with MRSA and all these other infections out there, you certainly need to get on it right away. If it doesn't show any progress in the first 5 or 6 days, it's probably time to see your family practice or internal medicine doctor. And then if that stalls and it gets no further, then it's time to see a wound care facility. They're just not aware of what the options are. And quite frankly, I was not. I was trained as an emergency medicine physician and a hyperbarics doctor. I was not aware of those options as well, but there is a great deal that we can do to kind of shortcut the processes that are disallowing the healing in the first place, so that we can get that thing to heal up and allow these patients to get back to their active lives.
I know that every case differentiates between patient to patient, but how long typically would you say when you get one of these people with a wound and they're a patient, how long can it be treated for, and how long does it take to heal?
There are patients that we, quite frankly, have had. We have one patient who has had wounds on her leg since the 1960s.
Wow.
And we're finally making progress. And it's one of those things where it can be very short-lived if we can put all the modalities to work at once. Other times it can take weeks, if not months. Even with all of that intensive advanced wound care, it can still take quite a while. It's because of that underlying disease, which we also try to work with the family doctors and the internal medicine docs to control, like diabetes or blood sugars and things like that. And then we have on our panel a vascular surgeon, 2 general surgeons, and then my partner, Dr. Britton. So we kind of have an array of physicians that allow us to then address problems. For instance, if someone needs a bypass in their arterial system for their leg that will facilitate healing, we can certainly do that as well. So we put together a panel of physicians and wound care nurses, and then of course the staff at the clinic to throw the book at it all at once. That's our philosophy.
Is that what really separates East Cooper from other wound care centers?
I would say this, to the great credit of Tom Moriarty, Evan Ray, and Jason Alexander at East Cooper, they assembled for us a world-class staff. We have 2 of the best wound care nurses I've ever seen in my life. We've got a great panel of physicians. We've got a great supporting staff that does the hyperbarics and things like that. So it's a joint effort on the patient's part and on our part, and it's worked very well since we started this in 2011.
Indeed. If people think they have a wound that needs more advanced attention or something like that, where can they go? Where will they get some more information?
Quite simply, they can call our office. Our clinic is right near on Bowman Road, right near the new hospital. They can certainly speak with their physician because we want to have them involved, obviously. But it's not required that they see their physician before they they call us at the clinic, and our number is 654-7337. And we typically get someone in that day or the next day, so that we can assess the wound, kind of get a full picture of what is the reason this wound is not healing, and then begin to take the steps to get it to heal up.
Sounds great. Dr. Tim Osmond, thank you so much for being here. We appreciate it. Great information there. All right, coming up, my friend and coworker Tessa Spencer is wanted by police for kidnapping. But I just want to say that this is a big game. But take a look there on that wanted poster. She's going to be here to tell us all about the Low Country mystery coming up next.